Hi, this is Chinny again at Health and Lifestyle in remembrance of World Hemophilia Day, which is celebrated this week. We're gonna have a little discussion on hemophilia. So what is hemophilia? Hemophilia is an inherited bleeding disorder in which blood does not clot properly. Then this can lead to spontaneous bleeding as well as bleeding during injuries or surgery. So blood contains different clotting factors that help to stop bleeding. In people with hemophilia, it's either they have low level of factor 8 or factor 9, or they lack one or two of those factors. So there are about 30,000 to 33,000 people living with hemophilia in USA. So what causes hemophilia? It is a genetic disorder. It is caused by a mutation in the gene in which one of the genes provide instruction for making the clotting factor protein to form a blood clot from either working properly or it is missing completely. So in hemophilia, there are certain things we have to be cautious of. There are things that we must avoid. We must avoid alcohol intake. We must avoid things like aspirin and aspirin-containing products, ibuprofen, and no use of acetylsalicylic acid. Also avoid the use of heat or warmth because that increases blood flow to an area. Things like jogging, basketball, football are not recommended. Any sport that is going to lead to impact is usually not recommended. Avoid massage because massage increases blood flow. Any drug that thinns the blood, things like our usual vitamins like fish oil, ginkgo biloba, vitamin E, garlic, ginger, flaxseed, green tea, all those are good vitamins, but in people with hemophilia, they should be avoided because they thin the blood. Also, other blood thinners such as heparin, warfarin, clopidogrel need to be avoided. We must make sure that we read our food label when we buy food products. So avoid food that are high in fat, cheese, processed food. Also maintain a good iron level. You want to include food that increases your iron supply, iron level. Things like liver, eating in moderation because it's an organ meat, and red meat, eat it in moderation because it causes other things like cancer. Also, you want to eat more of protein, leafy green vegetables, spinach, broccoli, dried beans, grains, raisins. Those are ways to increase your iron level. Also, eat foods high in vitamin C like oranges, bell pepper, broccoli, as well as try to maintain normal blood volume. You must make sure that your doctor is checking your blood count at least every 90 days because the blood recycles every 90 days. So make sure that your primary care doctor or whoever is providing care for you is checking your blood very frequently. Also, you can benefit from eating things like yeast, poultry, fish, and all the B vitamins also help in production of red blood cells. You must also eat food that are high in vitamin K. Vitamin K producing vegetables are things like broccoli, turnips, cabbage, asparagus, dark green leafy vegetables. They are all known to lead to production of red blood cells. Also, nuts are very important. So also is your sources of calcium, your tofu, figs, broccoli, again, asparagus. All these foods are high. Now, one other area that we need to discuss is the mental health aspect of hemophilia, especially among our young folks. These kids may feel left out among their peers. They will feel left out because they are not able to engage in sports the way their peers do engage in sports because of hemophilia. And we have to worry about the mental health impact of children like that. This is where we, the parents, come in. We have to constantly reassure them that it's okay, that they are not different. It's just that they are living with a chronic illness, and that we have to continuously encourage them to engage in safe sports. We find ways we can engage them without them feeling like they are left out, and without them feeling like they are different. They are not different, it's just that they have a chronic disease that they have to deal with for life. So we have to help them. We have to make sure that we connect them to mental health programs around. Things like supportive therapy is a kind of therapy whereby the practitioner or the mental health provider is able to help these young folks actualize their potentials, encourage them in areas that they need support. Also, we also need to make avail to them all the resources that they need to read to be very well informed about the disease process, because you can only manage disease process if you understand what it is. So that is where psychoeducation comes in. As mental health providers, we have to continuously make sure that we are availing all these resources to the young folks. Thank you. I hope you like my page. Subscribe if you have not subscribed, and see you next time. Bye.